Well, COVID-19 continues to put a strain on China. We still see some shutdowns in Shanghai. Two novel Omicron subvariants have emerged. And here to give us more insight into what's going on is our Anjalee Khemlani. Anjalee, what's the story with these new subvariants?
Well, Julie, a lot going on, especially in China, but also in the UK. So let's talk about China first. Shanghai still under lockdown on the western portion of the city, but we also see the eastern part of the city still under tight control with a lot of cases detected in the past week. So they're still keeping basically a lockdown in place, and then that stricter lockdown on the western portion. And they have detected two different subvariants of Omicron that have not been seen anywhere else before. So they're just watching that for right now because those are just two cases. But what's going on in the UK is actually more interesting, where that subvariant of Omicron, the XE, that's been identified in more than 600 cases. And so that is based on sequencing, which means that the proportion of cases is possibly higher. And just keeping an eye on that right now. All of this, of course, because as we know now in the US, where we have BA2 growing, we have to see what's going on abroad and how that may impact us in future weeks.
Yeah, at the same time, Anjalee, of course, we've seen a lot of restrictions that have been now completely removed, including the decision to remove masks on planes. Remind me of the effective date of that and what we've learned from it.
Right. So that is going to be in effect until April 18th. The CDC has until then to decide what to do. And they're talking about it right now. I had a chat with Dr. Anthony Fauci about what we might expect. And here's what he had to say.
When you're talking about masks in public transportation on airplanes, that really relates to the level of infection that's in the community. And that's the reason why that is still under discussion now by the CDC and is a work in progress.
So as you can hear, that focus on community level infection, that's actually key to understanding what we might be looking at right now, especially as we see the oncoming wave and what's out there circulating on the globe. It kind of puts a renewed focus on global vaccine equity, as well as the idea that there needs to be more done to help prevent further spread. As we know, the more spread, the more variants are out there. So we'll see what happens. Back to you.
Yes, we will. Holding our breath once again, as we've done so many times over the past couple of years. Anjalee, thank you so much. Appreciate it.